Hi, everyone. Welcome back. Today, I have part two with Dr. Natalie Crawford. She is the co-founder of For Fertility, a fertility clinic here in Austin. She is board certified in OBGYN and reproductive and endocrinology and infertility. I messed it up again.
Oh, you can even say REI.
REI. I messed it up on the first one. I messed it up again. She is stacked with accolades. The last episode we just did, if you have not listened, you definitely should go listen. It was excellent. I learned so much, things everyone should know. She's the host of As a Woman podcast. She won Best Fertility Specialist in Austin. We're happy to have you. Thank you for being here.
Thank you for having me. We could talk all day long, so I'm so excited.
We really could. I love to listen to you talk. So today we're going to focus more on trying to conceive.
Yes.
So if someone is trying to conceive, let's say they're just, okay, I want to try to get pregnant. Yep. Step one. What holistic things should they be doing? And for the woman, what holistic things should she be doing right now?
Okay. I love this. So before you want to get pregnant, let's kind of go through some of them. Number one, let's say stop our birth control. So if you are on any type of birth control or contraception, we want to stop that with enough time to get your cycle pattern and have some awareness of your cycle to identify any issues. We're going to talk about soon the length of time you're trying to conceive and what that means. But if your periods are not regular and predictable, you need to go see a doctor before you start trying. So number one, if you're on contraception, recommend you stop that 3 to 6 months before you want to get pregnant so you can see your cycle pattern. I'll give a big asterisk here. The exception, if you have a progesterone IUD and you have no period at all, I want you to take that out 6 months before you want to get pregnant because it's going to take a little bit longer for your endometrial lining to regrow. Or if you are using the Depo-Provera shot, that's the birth control pill shot. The shot you have to get every 3 months to prevent a pregnancy, but one single shot can prevent ovulation for 18 months. So yeah, a lot of pre-planning for that one, meaning no Depo-Provera shots for 2 years. If you think you want to get pregnant anytime in the next 2 years, that one's a no-go. But for the birth control pill or other types of hormonal contraception, usually 3 to 6 months is going to be sufficient so that you can then track your cycles. So number one, stop contraception. Number two is going to be learn to track your cycle. There are a million different apps that track your cycle. There's a lot of technology you can use. The easiest first way to start is by marking down when your cycle day one is coming. Each time, cycle day one, the first day you're having full flow bleeding. When it comes from there, we can learn how to detect ovulation. And there's two ways that I think, there's many ways you can do it, but there's two ways that I think are really easy to start with. And then there's a third way you can lean on. Learning to track your cycle when you're not yet trying is a little bit easier. It's data for your body. It's not quite as stressful when you're not like timing intercourse with it. And, this is what we call fertility awareness methods. So beyond having a regular cycle, how do you try to know when you're ovulating? So the absolute easiest, in my opinion, is called cervical mucus monitoring. So this is based on the concept that on ovulation, your body has peak estrogen that it's going to have. And so when you have peak estrogen, this thins out the cervical mucus. So inside your cervix, which is the entry point to your uterus, the mucus is usually a barrier so that nothing can get into your uterus and cause an infection. Except it thins out and becomes very stretchy, like an egg white, when you have that peak estrogen. And that's called type 4 cervical mucus. So this is very descriptive. When you want to check your cervical mucus, what we recommend you do is, when you go to the bathroom, before you wipe or go to the bathroom, you actually can kind of put your fingers either right at your vaginal opening, or you could wipe with toilet paper and look right away at what cervical mucus you have. If you put it on your fingers and you stretch it, your egg white cervical mucus, it will stretch. It's one of those things where it's like it when you see it. Mm-hmm. That is your ovulation time. And if you have egg white cervical mucus, when you're trying to get pregnant later, you can say, okay, that's when I'm going to time intercourse. This is free. This is easy. This is something that is a sign your body is telling you to help you know you're at your most fertile time. Another one is you can use ovulation predictor kits. These are called OPKs. This is urinary LH monitoring. LH is the hormone from the brain that is sent out when you do have peak estrogen, and it's going to cause the follicle to ovulate. So the follicle will rupture and the egg will come out. The LH surge happens before ovulation. So when you take these urinary kits, what I recommend you do is take them one time in the middle of the day. And when you see a positive, that means ovulation will happen the next day. Essentially, when you're not yet trying, we're just trying to see if it all makes sense. Does your ovulation sign kind of correlate with where it should be in your period? Are you able to get a positive? That's going to make it easier for you when you're ready to get pregnant. And then there's a ton of other options that have wearables that can track your temperature and give you an overload of data. That for each individual person, you might want to look into some of those. But I think starting with something that's free, like your own cervical mucus, is a very easy way. We also want you to take a prenatal vitamin. So a prenatal vitamin is going to provide nutrients that in the perfect world, we would all get from our diet. But it's not always realistic to get every single nutrient that a baby needs from your diet. The most important nutrient in a prenatal vitamin is going to be folic acid. And in fact, when I was in residency and worked with a really low income population, we would only give folic acid as our prenatal. So that is the most important one that we're given. Folic acid is important in cell division. And so if you think about what's happening when your body's making a baby, this tiny ball of cells is rapidly dividing and growing and organs are forming. And folic acid levels need to be high enough for the baby to develop the brain and the spinal cord. And the problem is those organs form at a very early stage when some women may not even know that they're pregnant. And you need high enough levels of folic acid in your cells to be able to support that type of cell division. So we recommend taking a prenatal vitamin at least 3 months before you want to get pregnant. That way your body can build up good nutrient stores and we know that you have enough folic acid. I will say that there's a lot of different prenatals in today's world, right? There's a lot of pretty colors and packaging and flavors, and there's gummy ones and other ones, and it can be very overwhelming. The best prenatal is going to be the one that you will take, right? So the one that you will consistently take is going to be the best. A lot of designer prenatals have included methylated folate, and I think this is worth mentioning. Methylated folate is a downstream metabolite of folic acid. So it is part of the process of folic acid being metabolized. Now, you or me, I'll say me, I'm not pregnant. So I might feel better taking methylated folate than folic acid. For some people, their body can use it a little bit easier. But you being pregnant, only folic acid has been shown to prevent very specific birth defects with improper brain and spine formation called neural tube defects. And so folic acid supplementation is the gold standard. Could methylated folate be enough? Maybe, but there will never be a study that would ever risk children being born with a birth defect to compare. And so if your favorite vitamin has a minty flavor and doesn't have folic acid, it has methylated folate, I recommend you go to the pharmacy and get an over-the-counter folic acid pill that has at least 400 micrograms of folic acid. Very tiny additional pill. It is such a big birth defect that it's just not worth the risk or the hypothesis that they're probably the fine. It's not worth taking it. So not all prenatals are created equal. So you really need to flip it over and look at the ingredients to kind of check what is inside. Outside of that, I think 2 other important things to just kind of holistically mention. One is that your doctor, your OBGYN, would love to do a preconception visit. And I think so often women don't know this. We
didn't know that.
We go to your OBGYN for your annual, and then maybe you go to them if you have a problem. But a preconception visit is not within your annual. It's a specifically carved out piece of time where you talk about, I want to be pregnant. Are there things that I need to do or things that we need to check? And your doctor will check certain things. So some of the most important things that are being checked then, one, and this is so prevalent right now, one's going to be your immunization status. So are you immune to rubella, which is part of the MMR vaccine? And are you immune to varicella, which is chickenpox? The reason why these 2 become of very big importance is they're both birth defect causing viruses. We know that as a population, we have very poor immunity right now. We have a measles outbreak, right? So that's one of the M's in MMR. And so we don't have herd immunity for a lot of this anymore. If you get exposed to one of these while you're pregnant, your baby could have very specific and terrible birth defects. So having enough antibody levels to be protected before you're pregnant is really important because we could give you a booster vaccine and prevent that risk from ever happening. And of course, women who might work with children or people who get sick are going to be at even a higher risk for this. But we can check your blood and get an antibody status. So if your antibodies are positive, that means you have enough of an immune response and you're good. And if your antibodies aren't high enough, then you're not protected and you could get a booster vaccine before you get pregnant. And that's just one thing I think so many people don't even know or don't think about, because so often, well, for so long, so many people have been immunized that we've had good herd immunity. But as we're seeing things shift, we really have to think about how we protect our baby the best. And you can't always control what you're exposed to. There's also blood testing for something called genetic carrier screening. And this is another thing that a lot of people are not exposed to ahead of time. Genetic carrier screening is to see if you and your partner both carry the same genetic disease. And what this means is a lot of these we might have heard of. Cystic fibrosis, a lot of people have heard of, or spinal muscular atrophy. But some people have never heard of them. The terrible ones, like I've had patients who carry something called Bardet-Biedl, and that's universally lethal. I mean, those children are going to die. And if you and your partner each carry the same gene, then you have a high risk of having a child who might be impacted. And that could completely change your reproductive plan. Meaning, if you had a 25% chance a child would die unless you did IVF and did genetic testing, you might say, I'm going to do IVF, or maybe you're not. I've also had some of these genes. I have one patient and they each carried the gene for congenital deafness. And they talked about it. They talked with a genetic counselor and they decided not to do IVF, but that they were going to, as a couple, take sign language classes. And they said, hey, either way, like if we end up having a non-hearing child, we're at least going to be prepared for what that would look like instead of getting this information on day 2 of life in the hospital when your newborn fails the hearing test. Yeah. And so their first child was hearing and fine, but their second child was non-hearing and they knew sign language. They were already plugged into a community. And so just that understanding that taking a genetic test can just give you data and information that then you can choose what you do with that information. Yeah. And I think the same thing in the same breath is that if you are somebody who has a really significant genetic family history, maybe you have Huntington's, which is an autosomal dominant disease that can be very debilitating. Maybe you've got a cancer carrying gene like the BRCA gene. These things, there's an argument that you should consider being tested for them because we can also screen them out with IVF. And I have patients who thought they would never have kids because they watched a parent die of an autosomal dominant genetic disease and they thought they never wanted to pass that on and then feel like this is some opportunity that they never thought that they could have. So that maybe is less holistic, but very medical about what you should do before you want to get pregnant, right? Track your cycles, learn to know if you're ovulating, do you need immunizations, genetic carrier screening, and take a prenatal vitamin. On the other end, I always say what's good for your body in pregnancy is how I want you to be when you're trying to get pregnant. So we know that pregnancy success rates are going to be higher when you are younger and higher when you are healthier. We know that higher levels of chronic inflammation can be impactful to have irregular cycles and also lower success rates with fertility treatments and lower pregnancy rates. So looking at your life, right, avoiding obviously toxic behaviors like cigarettes, marijuana, alcohol, looking at your diet and thinking about the foods you want to feed a pregnancy. Your diet should mostly consist of whole foods, lots of fruits and vegetables. You should limit processed foods, artificial sugars, refined carbohydrates. Those things need to be in moderation only. And then your healthy fats. I think a fun fact is that all of your hormones inside your body, they all come from cholesterol. And so cholesterol, the best source, is actually a lot of those healthy fat sources of cholesterol are more readily used to help make steroid hormones. And that's really important how your placenta will function as well. So the argument to get some of your fats from things like nuts and olive oil and avocados is even stronger if you're wanting to get pregnant.
Is that for both men and women or primarily women?
Well, for both, I think what we know is that, sperm health is half the equation when it comes to getting pregnant. There are people who will come and they'll say, I know it's my fault. Don't even test him. And I would say, no, absolutely. We're going to test both of you. But sperm and egg are both really sensitive to the world around you. So the same things, sperm are more sensitive, but eggs are also you have less control over them. They've been in your body your whole life. They are accumulating the wear and tear of just living life and getting older. And so those positive impacts are even more important when it comes to your eggs. But on the other hand, for sperm, you can make a positive difference because of the sperm life cycle being, so short. So I think that, fertility is as a couple's journey. If you're trying to get pregnant or you want to be pregnant, it's going to be very hard for one person to be trying to go to bed and the other person watching White Lotus at night, or, you're eating your sweet potato and quinoa and avocado bowl and they've got Domino's pizza, right? So we really need to kind of have an honest discussion with our partner and really get on the same page. And this is beyond just getting pregnant. I mean, this is what parenthood is all about too, because you're going to have to learn to make these important decisions later on as well.
What can men do to know more about their reproductive health? Because they don't have menstrual cycles.
They don't have menstrual cycles. And honestly, men's health is a little bit different to have an kind of easy identifiable marker. On the other end, all the evaluation that men do is much easier, right? So
of course,
a semen analysis requires an ejaculated sample, but it gives us a wealth of information about male hormones, sperm production, testicular function. So if you want to know, I think, getting a semen analysis, every fertility clinic does them, even if you're not a patient, if you just are wanting to get kind of a check on, do you have sperm? Some of the hardest cases in my career have been couples who've been trying for a prolonged period of time, finally come in, and then you find out that the male partner has zero sperm. And they feel like all this time they were just trying and there was not a low chance, but literally a 0% chance they were going to get pregnant any of those months that they were tracking and checking pregnancy tests. And it really highlights that, especially in this country, there's not a proactive approach to fertility in general. We are such a reactive field. I mean, the fertility industry, we have these amazing advances in technology. It's incredible, but it's relied on so heavily that we don't ever talk about what should you do to help your fertility? How do you check these things before you want to get pregnant? All the questions that you're asking, Shannon. Like, why don't we ever talk about these things? And I think it's just really highlighting the idea that the recommendations in this field have not caught up with how people are actually having families today, right? When people were having families predominantly in their early 20s, it was a really different landscape about when we would need to do some of these tests. As people are waiting older to start their families and they still want to have more than one child or they want bigger families, we are kind of coming out behind the gate. And then the idea that you should just try for a year. And then if you have problems, well, then we'll do an evaluation. To me, I hate that, because why do you have to already be kind of so down in the dumps before we even will look to see, normal markers of your health? I will say for men, if you're not having, or if you can't achieve or maintain an erection, if you can't ejaculate with intercourse, those are signs that you might have low testosterone. And so you should go get that evaluated. What we see is that sperm are so fragile. So women born with all your eggs, they are like living through your life, everything you go through. 1,500 sperm are made every second. Okay, so they're just pumping out these sperm. They are so fragile. They die all the time. Even when you freeze sperm, half of them won't survive the freeze thaw. They are just very, very sensitive beings. And so the environment for men is even more important and less discussed, because they have the opportunity to make the biggest impact of change. It's still important for women too, because we have egg quality as one aspect, and then our body gestates a pregnancy. So that's a second aspect. But a man can completely change his life. The life cycle of a sperm takes about 72 days to grow a sperm, 18 days for the sperm to get through the male reproductive tract into the ejaculate. So in a 3-month time span, you can totally change your sperm count. So things like smoking cigarettes, smoking marijuana can completely hurt your sperm count. That can often be reversible just by stopping that behavior. Taking exogenous testosterone is so common in this city. So I see so many couples where they went to, some health guru or holistic provider or somebody, and the male partner was given testosterone. And now maybe there was a reason why this was needed. Maybe he had low testosterone, but there are other more safe options that won't be so harmful to your fertility. What testosterone does in men is if you take testosterone, it tells the brain that you already have sperm because testosterone and sperm are made together in the testes. So they're made together. So if your brain sees testosterone, it says, cool, we must have sperm. And it stops sending out the hormones to make any sperm. And chronic testosterone use sometimes is an irreversible problem, meaning you might have no sperm that may not always be able to be reversed just by stopping the testosterone. So I think it's always just important too that, as a woman, especially if you have a partner, that you know what your partner's doing. If they're taking testosterone, they shouldn't be. If y'all want to have kids one day, marijuana every night just to calm down can have huge reproductive hormone implications, can completely obliterate the sperm count in addition to harming the quality of the sperm as well. And so both egg quality and sperm quality, I think we both hear that there's some factors you can't control, but there's some factors that you can control that we don't talk about enough. And these are the things that do contribute to some of this chronic inflammation in our body. And so these are things like toxins, our diet, sleep, exercise, stress. And these are factors that can make a difference in the level of inflammation that our body sees on a day-to-day level that over time can make a big difference for our hormones and our fertility.
What about phones, cell phones in your pocket?
Oh,
Is that
I love
a myth?
It's more of a myth with today's modern phone, but it hasn't always been a myth.
Okay.
Let's say that phones have changed a lot in what the radiation is that's coming from them. But there definitely have been studies when men keep a phone in their front pocket that showed decreased sperm parameters as compared to when they kept it in their back pocket or on a table somewhere. It appears that there's probably some combination. Again, the older phone models did worse. So it looks like that technology has gotten better to make the actual radiation less concerning. There still is also a concern for anytime there could be heat. So I don't know, you've ever used your phone and it gets hot. So the testicles are outside the body for a reason. They're meant to be at a lower body temperature to make sperm. And any time that temperature of the testes increases, it is very harmful for how the sperm are developing. So another example is if you have a dilated blood vessel in your scrotum, it's called a varicocele, you are having more blood come into the scrotum and that increases the temperature and that can impact your sperm quality. So if your cell phone is, in your pocket or, some guys I've heard have told me they put it like in between their legs when they drive their car. Why? Like, why not just, anyways, right in between, right under their scrotum when they drive their car? I don't know.
Place for it.
Right? But same thing. So anything that really is increasing the heat factor to the testes is a little bit different. So we do want to think about like hot tubs, saunas. We don't want that heat to be rising because that is hard for sperm.
Okay. I want to talk about exercise.
Yes.
I could talk to you all day. This is so fascinating. You touched on exercise in the last episode that we just did, but I want you to say it again here. So building muscle during this time period when you're trying to conceive, what is the significance of that?
So building muscle is extremely important when it comes to your hormonal health and your regulation, when it comes to trying to combat insulin resistance, which we know is a huge cause of chronic inflammation. When we look at fertility-specific studies, we know that women who move their body, who are building muscle, they have a higher rates of getting pregnant, they have lower rates of infertility, and they're having more success when they go through fertility treatments. Meaning the impact of exercise is so profound on our body. It is mind-blowing that so many people put it as the very, very last thing on their to-do list. Even just 20 minutes a day, right? Start with just carving 20 minutes of your day out. Take it away from your phone, right? Like you're spending 20 minutes scrolling on your phone or on TikTok or doing something else, and do something that's going to help your body for your hormone function, for your inflammation levels, for your egg and your sperm quality. And I think this is where like leaning on your partner, again, can be helpful, right? Like let that be an extra motivating piece you guys can motivate together. But we know that the mindset towards exercise has just been so skewed in society for so long. It's been used as a weight loss tool only and not been as a marker of health, right? But building muscle specifically and building strength in addition to making your pregnancy easier, because we know when you get pregnant, that progesterone is going to relax all of the ligaments and tendons in your body. You're more prone to injury, but also just to have back pain. Your body's changing. The more muscle and strength that you have, the better you're going to tolerate those physiologic changes of pregnancy, the easier childbirth is going to be and the easier recovery will be. But it's also putting you in a better hormonal state to help your cycle be more regular and to get pregnant faster.
We have heard anecdotally from a lot of our members who come from overdoing it. They're doing, 60-minute boot camp classes every day, and they're struggling to get pregnant. And I'm not saying that there aren't many, many factors when it comes to fertility, but we've heard from people who come and do Evlo, which were primarily strength training, shorter classes, less systemically stressful, and they're able to get pregnant easier. What is that about?
So, HIIT workouts, so high intensity interval training, is inherently stressful on purpose, right? The workout is created to try to help maximize fat loss. So utilization of HIIT work in a way where you might be trying to lose weight, because of course, becoming a normal body weight is important in your fertility and your pregnancy journey, might have more of a place than where it has in somebody who is normal weight, who doesn't really need to lose weight, but is looking at exercise to try to improve their health. When you are maxing things out and kind of breaking down your muscles and stressing out your body, very short recovery and doing it again, this is causing inflammation and stress within your body. What we know is that is not helping you get pregnant. And we look at studies comparing HIIT workout to more moderate activity. Moderate activity is winning. Mm-hmm. And so that means that we really have to reverse that mindset, right? Like, we don't need to punish ourselves with our workout. It doesn't have to be that long to be impactful. I've had patients tell me, oh, if I can't do it for 60 minutes, it's just not worth doing. Well, that's not true at all. That's actually the opposite of true. So just like anything, too much of a good thing can be harmful. We're really looking at hormone health, balance when you want to get pregnant, as really looking at treating your body with kindness and looking at a way that you shouldn't be just physically worn down from the things that you're doing, right? You need to get enough sleep. You need to really use movement in a way that's going to help you be stronger, have better posture, have more flexibility, but that's going to help you in such a more tangible way than your HIIT workout.
Right. I always say exercise should not make you feel like crap. It shouldn't make you feel like you got hit by a truck.
Oh, so true.
Then you're overdoing it.
Yes.
So let's say someone's doing all of these things and they've been trying for a few months. How long should someone wait before seeking a fertility specialist like yourself?
This is a fabulous question. And I think first we have to give the hard facts, right? Is that humans are not very efficient at reproducing. So even in our youngest years, if you are under age 30, you're going to have about a 20% chance of getting pregnant per month if everything is working normally.
That's it. Wow.
That's it. Okay. However, if I look at 6 months, over 70% of women will be pregnant within 6 months. If I go to 1 year, then another 13% will be pregnant. So the vast majority, but a much higher percent got pregnant the first 6 months than that next 6 months. The current medical recommendation and the current definition of infertility is trying to get pregnant for 1 year and not conceiving. So if you have been trying for a year and you've not gotten pregnant, you definitely need to go get an evaluation. We are nice. We're going to dig through your history, try to see if there's any issues. We're going to kind of work through some of the top causes. I always say we're going to do testing and we'll meet back up and go through it. Like, you're not committed to anything. You're just getting data about your body. The fact is, though, a lot of people who don't get pregnant those first 6 months are not going to get pregnant in the next 6 months. And so I always say you can always get an evaluation earlier. If you're age 35, we recommend that you do. So if you're 35 and you've been trying to get pregnant for 6 months and you haven't, we recommend seeking an evaluation at that point. And that's simply because of the impact that age has on your fertility. If you're trying to start your family for the first time and you're 35, your odds of getting pregnant per month are now closer to 12% per month. So that's lower. If you're 38, it's going to be 5% per month. So we can see that there's this huge natural decline in fertility as we get older, tied to the genetic normalcy of our eggs, not to being out of eggs, but to the fact that the quality of the eggs is going to decrease over time. So if you're 40 and you just found your person and you're ready to get pregnant, I usually say, just come right in. like just get tested right away. If everything's normal, then you have that reassurance, and then we can talk about how long you should try before we do treatment, or do we want to do treatment faster? But what we don't want to do is be in the position where you waited longer and then we find out something happened and we weren't able to intervene on it in a time where we could make a difference.
Yeah. This is all excellent. Again, we could go way longer, but you got to go pick up your kids.
I know. Do you have like one more? You want to do one more question? Do you have one
Should
more?
we do one more question? Parting thoughts or any wisdom or words for someone who's trying to conceive and struggling?
You know, I've been there. I had multiple pregnancy losses before I got pregnant with my kids. And I know how hard it is to both feel isolated, feel left behind from your peers or your friend group, to be questioning all these things maybe you thought you knew about your body, or questioning the future that you saw. You aren't alone, even if you feel alone. And I think that's a really important factor to say. One thing that I didn't do when I went through it is I didn't share my story with anybody. It was a while ago. It really wasn't what people did, but I didn't give the people even in my life who I know could have shown up to support me the opportunity to do so. And so I think that if you are struggling, you don't have to tell the world. You can. People who are sharing their story in real time on the internet are so brave and vulnerable. They are impacting so many people's life because they are showing people that they are not alone and that there's options out there. But if you are struggling, at least opening up to your person, maybe it's your mom or your best friend or your sister, have somebody who you can share all those scary thoughts with and let them show up and support you. Trying to bottle it all in makes the process even harder than it has to be. And even though we talk about all these factors that you can control to try to help and optimize your chance of success, infertility by definition is a process that you lack so much control in. And I always say I can't always control the outcome of what's going to happen, right? We're going to control, though, that we had all the data we needed, that we were able to make choices from a place of empowerment and knowledge, and we made the decisions that were right for us. And we're going to hope that all of that leads us to success in the end. But the worst place to be is to feel like you weren't given the chance to make that choice, or you didn't know enough, or you weren't able to advocate for yourself. So you're never wrong to go get an evaluation earlier. If you are not resonating, if you see a fertility doctor and they're not right for you, go see somebody else. Go see somebody else, right? Find somebody who you feel like explains things to you, answers your question, and is your partner in the journey, because the journey is what we can control sometimes even more than the outcome.
You are such an incredible advocate, and just hearing you talk and hearing you educate is extremely important. And again, I know that so many people will listen to this and find some peace, and I want everyone to go follow you, find you. So tell us where we can find you and your podcast, all the things.
Thank you. So online, I'm on Instagram at Natalie Crawford, MD, and the podcast is called As a Woman. And then if you are a fertility patient and you want to reach out, the clinic is Fora Fertility. That's FORA fertility.com.
Awesome. Thank you so much for being here.
Thank you for having me. I've loved it.
Oh, so fun. Thank you, listeners. We'll see you all next week. Same time, same place. Bye for now.